This healthy living tip is brought to you by the Christ Hospital Health Network.
It's known that there are about 27 million American people who have diabetes, and about 7 million are undiagnosed every year. Type 1 diabetes is a disorder of human immune system. In type 1 diabetic patients, the immune system attacks the cells of pancreas, which causes to less or no insulin production. So type 1 diabetic patient needs to be on insulin for the rest of their life. Type 2 diabetes is the most common type of diabetes. This is characterized by high blood sugars, mainly due to insulin resistance, so the insulin which is available is not utilized effectively. Gestational diabetes is a condition which occurs in pregnant women who never had diabetes before. During pregnancy, there are hormonal changes where the cells can become less sensitive to the available insulin. So body needs additional insulin, and the pancreas kinds of works harder to make more insulin. Once the pancreas cannot meet the increased demand during pregnancy, then we start seeing higher blood sugar causing gestational diabetes. Although this kind of diabetes disappears after the delivery of the baby, most of the women who have had gestational diabetes do have increased tendency to have type 2 diabetes later in their life. Most of the pregnant patients can be treated with medication if they are on diet control, but some patients, if their numbers are really higher, then they need insulin just during the pregnancy period. Prediabetes is another condition where your blood sugars are higher than normal but not high enough to diagnose diabetes. The long-term damages starts occurring during the stages of prediabetes, especially the heart diseases, and the circulatory system is affected. Patients who have prediabetes who are not well controlled most likely tend to become diabetic. Diabetes seems to be significantly increased when in the ages of more than 40 years older. Locally as well as nationally, we are seeing that. Genetics and family history of diabetes itself is an important risk factor. Ethnicity also comes into matter, especially African Americans, Latinos, Hispanics, and Asian Americans are at greater risk. Common causes which can increase risk for type 2 diabetes includes past medical history of gestational diabetes, polycystic ovarian diseases, obesity, overweight, and lack of activity. The most common symptoms we look for is increased urination, increased thirst, unintentional weight loss, blurry vision, tingling numbness sensation in your arms or legs. The first step, if you have the symptoms, is to call your primary care doctor and have some blood tested. There are different tests we normally do to predict diabetes. We could do a fasting blood sugar, we could do an oral glucose tolerance test, and hemoglobin A1C. There is no known cure for diabetes, but we can help to control the blood sugars, which prevents the complications. So the key to successfully managing diabetes includes to learn more about diabetes, how to live with it, especially meal planning where you restrict carbohydrates in your diet, and regular exercise and increased physical activity. So Christ Hospital have certified diabetic educators who helps with self-management training. We also provide additional specialized training in insulin pump therapy, continuous glucose monitoring, and intensive insulin therapy.
To locate a diabetes specialist near you, call 585-1000 or visit thechristhospitalphysicians.com.